So hospice care dates back many centuries, and at the heart of it, in the beginning, it was really about hospitality, or offering protection and rest for the sick and the weary. So throughout the centuries, as it has progressed, hospice has become a medical specialty that Medicare and insurance acknowledges as an opportunity for patients and families, or maybe not families, but just anybody that's surrounding a patient, to help care for them in the final seasons of life. So palliative care is very closely related to hospice care in the sense that even on hospice, we are working to palliate symptoms and create more comfort and quality of life. But palliative care also encompasses being able to support patients and their families, or those that support them, when they are still pursuing curative or aggressive treatments, measures, and the palliative care is an additional support. Again, it's a medical specialty with multiple disciplines involved in that care and support. So the guidelines exist to help us determine when a patient might be at that point. And those guidelines generally are about chronic conditions and becoming end stage in those conditions. So it can be heart disease, lung disease, Alzheimer's or dementia, cancer, neurological disorders. But really, as far as that criteria goes, because those are just guidelines, there is also the non-disease specific criteria where someone may not have a really specific illness, but because of maybe aging or overall changes in debility, they still might meet criteria for hospice. And then palliative is somewhat similar, where you're still approaching the end stages of a chronic illness, or maybe something like cancer. But again, for that criteria, you're still wanting to do some curative measures, but you additionally need the support of comfort and quality of life in addition. So as far as the goals of care for hospice, it is individual to everybody. So no two people have the same goals. And obviously most of us don't know what end of life is going to look like. And there's a lot of fear and trepidation about that. But at the end of the day, the goals of care are whatever you as a patient want them to be. So some people just want to not have any pain. Some people want to feel as good as they can so that they can spend as much time with their family as possible. So goals of care is really individual, but what is always consistent about goals of care on hospice is that you are no longer focused on curative measures or aggressive treatments, things like going into the hospital. So that is a consistent goal of care, but really otherwise it's very specific to each patient and family and those that care for them. Palliative is typically about just having that additional support to make decisions about goals of care. So maybe on palliative you are still involved in getting curative measures or treatments, but you're also having a lot of symptoms that are causing you decreased quality of life. So then that additional support of palliative care professionals helps you to be able to maintain those curative measures but still improve your quality of life at the same time. So those would be the goals of care. So for anybody that is interested in learning more about hospice or palliative, or maybe they just have questions about how either medical service and specialty might be able to help support them, Royal Hospice and Vital Palliative can be reached online or 24/7 by phone.